Hi, I'm Davida Kruger. I'm a certified nurse practitioner at Henry Ford Health Systems in Detroit, Michigan. I'm here today on behalf of iDoc to talk to you about glucose monitoring and all the devices and methods available for you. There's been an explosion in the world of diabetes in terms of what's available to manage diabetes. What we do know is that we need data. We need data of blood glucose monitoring and any other type of data that we can get to help patients manage their diabetes and also for them to be able to manage their diabetes at home. Diabetes is a self-management disease. They spend most of their time taking care of their own diabetes. And as a nurse practitioner and a diabetes educator, it's my responsibility to give them the tools and the knowledge, or help them with the tools and the knowledge to best understand their diabetes and what their glucoses mean to them and what to do when they look at their glucoses. So we have all kinds of blood glucose monitors available. In terms of accuracy, we see fairly good accuracy or good accuracy with just about every device on the market. And some of the issues in terms of how to choose a blood glucose monitoring is really based on the needs of the patient. And I like to show them a couple of monitors to see if they fit within their style. Now, some of the limitations are also within the insurance companies who may or not dictate which of the devices that they'll cover. But by and large, we let patients look at the devices and pick what's best for them. How many blood glucoses a patient does is really dependent on whether they have type 1 or type 2 diabetes, whether they're on oral agents or whether they're on insulin. And even patients, though, that are controlled, their diabetes is controlled with diet only or a medication such as a metformin, we like to have blood glucose monitoring because of the fact that if a patient sees where their blood sugars are, it helps them know where they're going, and then the activities they've done or the food intake they've done, what does that mean to them in terms of what happens to their blood glucose? So it doesn't matter who the patient is or what kind of diabetes they have or what kind of medications they're on, blood glucose monitoring helps them guide what to do next with their diabetes and how best to manage it. And what we like to look at is not one blood sugar, but trends. So that if they wake up one day with a low blood sugar or a high blood sugar, that's not an immediate alarm for change medication or adjust medication. It means let's look at the next day or the day before or the activities of that day, and based on a trend of what's happening before breakfast or before dinner or at bedtime, let's make some adjustments. The other thing is, I only see most of my patients every 3 months. If they're looking at the blood sugars in between those 3 months, then they can call and say, look, the last 2 weeks I'm noticing an increase, or the last 3 or 4 days I'm having a problem with low blood sugar. And we can be proactive in between their visits rather than just at their visit, so that when they come in to see me on the 3-month visit, there isn't an increase in their A1C or they're not having hypoglycemia events that they can't handle. So all of that is very helpful to the patient. Some of the exciting things that are going on in blood glucose monitoring is patients' ability to send them to the provider either via the internet. Some devices can be sent via telephones. And the newest is for an iPhone, an application by Agametrics on the iPhone that can be downloaded free, and I think it's agametrics.com or Agametrics in there, that allows you to download this application onto your iPhone, and you can manage all of your glucoses right on there, and it has information on nutrition and different educational components, and also the ability to directly send your glucoses to your healthcare provider, who can then help you manage your diabetes in whatever way you need. And then for a little bit more sophistication, or in addition to blood glucoses that we do through finger sticks, is continuous glucose monitoring. Now, continuous glucose monitoring is not standalone. It's in addition to blood glucose monitoring. So you're not going to give up blood glucose monitoring when you move into the world of continuous glucose monitoring. They work in tandem, hand in hand, because continuous glucose monitoring is a trends type of device, and there is a little bit of a delay depending on the device and depending on the patient of what you're seeing on the screen of the continuous glucose monitoring and what your actual blood glucose is. it's a lot of data too. Not only as a healthcare provider did I have to get used to looking at all the data that comes from a continuous glucose monitoring, but actually sharing that with the patient and back and forth. So learning about all the graphs, learning about all the trends, understanding standard deviation. And I'm not saying all of this to make it sound like it's out of the realm of understanding, but to be aware that there's a lot of data out there that you can work with and certainly help patients best control their diabetes. So what's the exciting part about continuous glucose monitoring? Well, you're getting over 200 blood glucose per day versus 2, 3, 4, even 7 or 8 that a patient might be doing on finger sticks a day. You also get not only the actual blood glucose, but what direction is that going? So if a patient looks at the screen of their continuous glucose monitor, it may say the blood sugar is 160. Now, does that mean that patient needs to treat that 160? It also tells them it's a blood glucose that's on the way up or a blood glucose on the way down. So if that's a blood glucose of 160 on its way up to 300, that might give that patient an opportunity to correct that before it becomes too high. Or if it's blood sugar on its way down, to correct it by eating something before they become hypoglycemia. So it's important for them to watch the trends, and there is a trend screen on a continuous blood glucose monitor so that they can see over time what's happening to the blood glucose. And then they, in addition to doing that, they would then do a finger stick before they would correct to be sure at the moment what's happening to the blood glucose. But it gives us an opportunity to look at the trends over time, and then we can compare 3 or 4 days what's happening in the trends, a week in the trends, 3 months in the trends of blood glucose, and make some really good decisions as to what do we need to do with insulin. An example for this might be patients that are having hypoglycemia overnight and we can't catch them, or a patient that we just can't figure out why their A1C is 8% all the time, but if we can look at what's happening to that patient, say they're always high at a particular time of day and we're not aware of it, we can then make an adjustment for that patient in how they monitor their blood sugars and the treatment regimen that's provided. So there's a total explosion of what's happening. Right now there's 3 devices on the market for continuous glucose monitoring, one that's made by MiniMed Medtronics, one that's made by Dexcom, and one that's made by Abbott. All of them bring great value to patients, and when picking a continuous glucose monitor, we actually have patients go online, read about them, get better understanding of what they are and what they aren't, make sure they understand that blood glucose monitoring is still part of the regimen if they're going to do continuous glucose monitoring, and making sure we pick the right patient, because continuous glucose monitoring is not for all patients. But it's a pretty exciting time. It's never a great time to have diabetes, but it's certainly exciting with what the devices we have available, the ease of use, the data we can get back, and the information we have so that we can best help patients monitor their diabetes and for an improvement in their outcome and their prevention of hypoglycemia and lowering their A1Cs to treatment goal. I hope this information has been helpful for you. There's websites on each of the devices that I've mentioned that if you're interested, you certainly can go to each of the websites and learn more about it. Thank you for listening on behalf of iDoc.